Hello everyone, my name is Awab Musaad, and in this video I'm going to cover the topic of hyperkalemia. It's a common topic that doctors would ask you about during your internal medicine rotation. So let's get an idea about the treatment of hyperkalemia. But before we do so, let's remember the cause, the most common causes for hyperkalemia. Usually we think about things that would reduce the secretion of potassium into the urine. So stuff like chronic kidney disease, potassium-sparing diuretics specifically, and diabetes. Insulin pushes the potassium into the intracellular space, so a decrease in insulin would lead to hyperkalemia. Usually this hyperkalemia would present with muscle weakness, weak reflexes, but the most serious complication or presentation is arrhythmias or palpitations. But these, the good thing, usually can be detected before they happen by some ECG changes like wide QRS complex, long PR interval, peak T waves. Okay, and these would call for an emergent intervention because after that the patient can develop arrhythmias. So what's the treatment? So we're most afraid of arrhythmias. So what we'll do is simply protect the heart by administering calcium. That will protect the myocytes from the potassium all around. And after we do so, now we'll start focusing on getting rid of the potassium in the blood. First, we'll deal with the potassium in the blood by giving insulin. Okay, as you know, insulin would push, as we said, the potassium into the intracellular space where it belongs. But also it pushes other stuff like the glucose. So we would give also dextrose or 50% dextrose to avoid hypoglycemia. Okay, so we give calcium first to protect the heart. Then we'll start getting rid of the potassium by giving insulin and 50% dextrose to avoid hypoglycemia. And then we get rid of the potassium on the long run by secreting it into the urine and into the feces. Into the urine by using diuretics. Of course, these diuretics now are not the potassium sparing, but rather, the loop diuretics, for example. And xylate usually would get rid of the potassium into the feces. Okay, so we're eliminating the potassium into the urine, into the feces on the long run. Okay, and that was it. So thank you guys for watching, and see you in the next one.